Tang and Xiao Yao San are two formulas that are very commonly used in the clinic. On the left here you have Tang, and on the right you have Xiao Yao San. They also share a lot of common points, such as they are both targeted at the combination of constraint and fire. So there is both in the mechanism Qi constraint and also some degrees of heat and fire going on. They're both targeting at liver and gallbladder problems in general, so that's a very large area and very large scope of disease that can be used. They both can be very useful for emotional disorders and both used commonly in the clinic for all sorts of depression, anxiety, insomnia, all these sorts of problems. And finally, they both work on wood-earth balance, so the balance between liver, gallbladder, and spleen, stomach. And we know that this is the domination or the controlling cycle. So there is the idea of reinforcing the earth and inhibiting the wood in both formulas, really. So it can be very confusing for students, especially, and for young practitioners, people who start to use herbal medicine, to know which one to use, because they both are very similar and we don't necessarily understand why I should select one instead of the other. So in this video, we're going to do that. We're going to run through the differences between Tang and Xiao Yao San from two different perspectives. First, the perspective of the constituents of the formula, and also from the indications they have. But the core aspect we're going to use here will be really differences between two different channels. So there is one which is the Shaoyang channel, especially the gallbladder channel, really, and the Jueyin channel. So here we're talking more about the liver, of course. And this is a good opportunity to actually try to understand the difference between these two channels and how they are used in the clinic. And once you have this basic understanding of how these two sets of channels, and this has of course some link with the 3 yin and 3 yang, how they work, what the difference is, then it will help you to be more efficient, both in acupuncture, so using the channels, and in herbal medicine using Tang and Xiao Yao San. So when we compare the Shaoyang Jing and the Jueyin Jing, there are a couple of things to take into consideration. First, so the Shaoyang channel, we remember it's a yang channel, right? So if it's a yang channel, it's related with Fu organ, not Tang organ, and especially the gallbladder. But there is also a link very close to the stomach because we're talking about Fu organs. We also remember that Fu organs tends to be used to move, to circulate our vital substances, food, qi, body fluids, etc. Whereas the Zhong organ, they store the vital substances, such as qi, blood, essence, etc. There's a bit of difference here. The second one is the Shaoyang is a ministerial fire, right? So there's a clear emphasis on the Shaoyang, on the fire being one of the important pathological aspects. Now we're going to see that on the Jueyin as well, but it's more secondary aspect on the Jueyin channel. It will not be a primary thing. Very important, so it's a channel that is abundant in qi and scarce in blood. All right, and that's super important to understand the difference between the Shaoyang and the Jueyin. So Shaoyang has obviously this function of promoting qi movements around the body. That's really where the abundance in qi is obvious, and also in the whole metabolism process. So the qi transforming food, qi transforming body fluids, qi pushing blood, all these things. But at the same time, it's scarce in blood. So what is important is to remember that the liver has the yin body, so it's storing blood and using blood as a fuel, and its function is yang. So in Chinese we say gan ti yin or yong yang. It's a yin body and a yang function. So yes, so we can see that the Shaoyang is not really working too much on the yin body. That will be the role of the drain channel. The head, so the Shaoyang channel and the drain channel, this share very similar pathways. So they both on the side of the body, on the side of the hips. Side of the hips is really the Shaoyang. The side of the flanks of the body, so the hypochondriac region. Yes, the side of the thorax, etc. So all this region is drain and Shaoyang region. But the difference is that the Shaoyang Jing is more about the head, neck, and all the sensory organ, eyes, the ears, the throat. So this region is more Shaoyang region, right? Also, the Shaoyang is a yang channel, so we have to remember that yang channels are connected with the surface. So here, the surface, we're not talking about the Taiyang surface, we're talking about all the skin, muscles, blood vessels, bones, etc. So all of these are the surface of the body. It's not the organs, which are the interior, and they include, of course, the channels and meridians, which are also on the exterior. So the yang channels will work more on these aspects. So that's why the Shaoyang Jing and Xiao which is a typical Shaoyang formula, can work on the exterior as well. So there is the idea also of yang being related with acute conditions compared to the yin, which is more chronic conditions. The Shaoyang channel, so the gallbladder channel, is paired with the triple burner. So again, that will be an important distinction between the drain and the Shaoyang. So at the opposite, the drain channel is related with Zhong organ. It's a yin channel. So it's mainly related with the liver. In terms of spleen and stomach, it has a closer relationship with the spleen instead of the stomach. The drain channel is also a wind-wood channel. So when we think about wind, just get out of your liver wind, stroke, hypertension, this sort of thing. So it's more general. You see in the nature what wind does. It's creating movement, right? Creating movements around. So we need a little bit of wind around. We need to have this movement, this flow of air, but we don't want to have too much of this movement. Otherwise, there is a storm going on. So it's exactly the same for the drain and for the liver. This idea of regulating qi movement in the body, not having too much, but not having enough qi movement as well. And that's really the function of the liver and the drain channel. And of course, we have this aspect of qi movement in the Shaoyang as well, but it's primarily something coming from the drain. That's this regulation. There's also the idea of abundance in blood and scarce in qi. So here we see that the drain is working more on the body of the liver, so the yin blood nature, and which is the fuel of this function of regulating qi movements. Also, in terms of pathway, the drain channel is going to the genital area. The Shaoyang doesn't have this close relationship because it's a yang channel, so it's more related with the exterior of the body again. So drain channel again, more important for interior conditions and also very important for chronic conditions, because again we're working on Zhong organs, which store the vital substances, qi blood essence, body fluids. So the chronic aspect of the liver gallbladder is really a drain aspect. Also, it's paired with the pericardium, so we have also this relationship, which is not the same as for the Shaoyang. All right, once we have this, let's analyze the constituent of the formula. So we mentioned that there is this relationship with the gallbladder and also the stomach. This is very obvious when we see the use of Wanxia and Shangjiang to this combination, which is really a typical stomach harmonizing formula, right? These two herbs. So and they also promote the movement in the full organs, right? The descent of the food in the body. So there is also this aspect in this formula. Ministerial fire, so that's why we have Huangxin here in the formula, and this is one of the main ingredients with Chaihu. So this combination of Chaihu and Huangxin is really here to get rid of this excess of ministerial fire, which is, yes, connected with constraints, but it's also important that the heat is quite obvious here. Because it's abundant in qi scarce in blood, this formula is working more on the qi rather than the blood. So we have a bit of daza, which can be helpful for the blood, but it's not a strong blood nurturing herb. All the other herbs are working really on the qi level, right? So head, neck, and sensory organs, again, there's a lot of inflammations going on in this part of the body. And that's where Huangqing is really helpful, because Huangqing is a good anti-inflammatory herb, especially for the upper part of the body, so for the upper jiao, right? It's really good for exterior and acute conditions. So again, we have this this combination of Chaihu and Huangqing, which is really good for infections in general. So there are lots of antimicrobial effects, etc. And we have Shangjiang, who is here as well to help out this this idea of relieving the surface, and also think also about the combination between Shangjiang and Dazao, which is also here to regulate the productive and nutritive, so that's why you see this formula can be also combined very easily with Guizhitang, and we have examples in the Shanghai Lun of Chaihu Guizhitang, which is really here for the all this exterior acute condition, especially when there is bodily pain, joint pain. We can definitely use this formula. I tend to use this formula a lot for people who have the stress-related bodily pain, or we call sometimes somatoform disease. It means that people who have mental disorder develop some pain in the body, but there is nothing, there is no inflammation, there is no joint arthritis, anything like that. So Chaihu Guizhitang is very helpful for that. And again, we have this idea here that the Shaoyang is a yang channel, so it's especially in combination with the Taiyang, they can be really useful for exterior conditions. Acute, so that's also a very important point. Generally, Xiao Hutang is used in decoctions. Of course, nowadays we use granules as well, but it's not a formula you're supposed to use for a very extended period. You're supposed to use it just for a few days. And the Shanghai Lun, it was very obvious that it was the case. People were supposed to use it for a few days only. There was also very high doses, so it's common to do that for acute conditions as well. You see many people use 24 grams or 30 grams of Chaihu. That's the kind of thing you do for acute conditions, not for chronic conditions, right? Otherwise there is a risk of toxicity, of course. I would also like to emphasize that yes, that the Chaihu is they use in decoction, not in manufactured products. So we'll see later for Xiao Yao San, it's a bit different. Alright, finally paired with the triple burner. So again, we have this idea. It's not really manifested that well in the ingredients, but there is this idea of moving the qi in the triple burner and more at the qi level. That's why we have so many qi type herbs, so banxiao, renshen, all of them Huangqin, very typical qi level herbs. Now we're going to have a look at the Xiao Yao San now. Xiao Yao San is a bit different in this respect. So again, it's working more on the organs. And here we're working more on the spleen rather than the stomach. So remember we had Shengjiang and Banxia for the stomach. Here the main ones, Shengjiang is really not a very important herb. In Xiao Yao San, many people tend to actually remove it. It makes a lot of sense. It's okay to do that. But Baizhu and Fuling will be very important herbs here, and they really they are reinforcing herbs, right? In the Xiaocha Hutang, we have this idea of working with external conditions, and if you check the text in the Shanghai, it explains very clearly that there is a lack of regular qi is weak, and that's why evil qi is attacking the body, and there is a fight between the regular and the evil. And that's why in Xiaocha Hutang it's important to have herbs that tonify, that strengthen the qi. And this will be some relatively sweet herbs such as renshen, gancao, and dazao, which are typical to really promote the qi and blood in the body, to strengthen the energy, basically, right? And to fight against the infection, the external pathogens. Here in Xiao Yao San, it's very different. We're using Baizhu and Fuling, which are really, they're not strong qi reinforcing, qi tonic herbs. What they do is they regulate. So they regulate the spleen, they regulate the metabolism. It's a more long-term process of getting rid of the phlegm and dampness in the body, improving the digestive system step by step. And we need, and for this we can't use Renshen, Gancao, Dazao because they are too rich. They tend to be a bit greasy, so they are not great at actually to reinforce the spleen, right? When there is spleen deficiency, there's generally some dampness going on at the same time. So all right, so we see that Xiao Yao San is also working more on tongue organs, and it's also so we have talked about the spleen, but there is also the kidney, which is here important as well. In the Jueyin, there is a strong link between the kidney and the liver here, between essence and blood. It's not surprising that one of the modification of Xiao Yao San is black Xiao Yao San, Hai Xiao Yao San, which is the addition of Shangdi Huang in the formula. And again, the idea here is to tonify blood and essence. So there is this link with the kidney, okay? And there is basically this idea of promoting the storage and the function of the organ, and using qi and blood to promote this function, right? Instead of working on the function itself. So, but we'll see that later. So for the wind wood aspect, it's also quite obvious with so there's this aspect of moving, really. We have Chaihu, of course, but it's helped by Bohe and Chengjiang as well. Yes, we have this idea of reinforcing the function of the liver to move qi and blood in the body, but it's also abundant in blood and scarce in qi. So the idea here is to nurture the body of the liver, so the blood, and we do this with Dongui and Baishao. And to a certain extent, also we reinforce the spleen so it can be able to produce qi and blood, which will reinforce even more the blood of the liver. And then we're using this reinforcement to make sure that the liver will be able to move blood, but we're not really move qi, sorry. So we're not really strongly using strong methods to push the qi around as much as possible, to force it, right? The idea is to work more on the long term, to regulate the environment around the liver, so nurturing the blood, making sure it has enough fuel, Also reinforcing the spleen, so making sure the balance between liver and spleen is also well adapted. So giving the condition to make the liver being able to work. Okay, so you can imagine that it's not a formula that will work very quickly. It's not supposed to work quickly. The Jueyin channel is also, it goes to the genital area, which is a bit different from the Shaoyang, and that's why we use it. We have this Dangui and Baishao, and for all the gynecological problems. So we remember that Xiao Yao San is by essence a powder, it's a san, and it was recorded by the Taiping Huimin He Jufang as an idea of promoting the use of manufactured products, such as powders, to patent medicine. So the idea really here is to use it for a long term. We're talking about chronic conditions, we're talking about months of treatment to regulate the constitution and help our people getting better and better. This is very different from the approach of Xiao, which is I want to fix problems quickly. Here it's more I want to regulate the constitution, so slowly the person will get better and better. The last one is these are the pair with the pericardium. Again, we have lots of blood herbs in this formula, especially if we think about the combination, the modification, Danzhi Xiao Yao San, which is the addition of Danpi and Zhizi. So you can see really that here we work both on the liver and the heart in this situation, and lots of herbs related with blood and the blood movement, which is really the function of the pericardium. All right, so let's talk about the indications, the differences between Xiao and Xiao Yao San. So if we check the Shanghai alone, which is the first to record Xiao, I think it's good to start with the indications of the manifestation of the Shaoyang disease, which is, according to the article 263, is bitter taste in the mouth, dry throat, and vertigo. All right. So again, here it's typical Shaoyang type of problem. So you see the Shaoyang is going to the throat, to the mouth, also to the head. So all this idea of headaches, dizziness, bitter taste in the mouth, dry mouth, eyes problems, etc., related with the Shaoyang, not the Jueyin. Also, so here very specifically during the 5th and 6th days of the cold damage, so it states very clearly Xiao is a formula for external conditions, external afflictions, basically infections, right? So there is alternative in chills and fever, fullness of the thorax and sides, mutism, lack of appetite, agitation, frequent vomiting. So here the agitation is representing really this idea of heat. If there is even more excess of heat and fullness of excess constrained heat, it's when you will think about Xiao. But you can see that it's already there in Xiao, this idea of heat going on and going upwards. So of course we have this idea of emotions and blocked chest, mutism. That's a common point between Xiao and Xiao. And here we have frequent vomiting. So when we think about stomach discomfort, Xiao will be more useful for this type of condition. So in terms of indication, we have respiratory infections, and I would say especially throat pain. My teacher back in Beijing, Dong Zhenhua, was using very commonly Xiao added with Shaoyang San. So these two formulas for all kind of throat pains, and it was very helpful, very simple formula, no side effect really. Yes. ear and eye inspections. Again, so that will be something you will think about Xiao instead of Xiao Yao San. We're talking about the Shaoyang pathway, so all the head, ears, eyes, etc. For parotitis, I've seen that a lot. Again, my teacher, Dong Zhenhua, was using it, this formula a lot for parotitis. He was seeing a lot of patients with Sjogren syndrome, which is autoimmune disease that affects the salivary glands. So one of the if the patient had really acute parotitis with inflammation, it was swollen, red, etc., etc. Instead of, and patient would have, of course, a very dry mouth because the saliva wasn't produced. Instead of working on creating body fluids, he will use Xiao with some heat toxicity clearing herbs, Jininhua, Lianqiao, etc., Balangan. Added with a few also for nodules transforming herbs, Xiakutao and Xuanshen, Zhaojiaoci, etc., to break the nodules, and it was very helpful as well, very effective. I know people use Xiao for urinary infection and constipation. So again, here we have the idea of promoting Qi movements in the whole triple energizer, and so we'll drain the whole triple energizer. So the food, the stools, and the body fluids can all be evacuated. There's also the idea of breast conditions, so we can use both Xiao San and Xiao, but there will be an emphasis on Xiao if it's breast infections, right? Because we have Huangqin here inside. Also stomach conditions, so nausea, stomach pain, stomach bloating. We can think about Xiao instead of Xiao San. For headaches, anxiety, and insomnia, I think we really can use both Xiao and Xiao San. But again, the idea with Xiao is to work quickly, right? So you want to use high doses for short term and change the symptoms very quickly. This is not something you will achieve with Xiao San, which is supposed to be taken for weeks and weeks before it starts really to slowly reinforce the all the context and the environment of the liver, so it can work a bit better. Then for Xiao San, if we check the original indication, I really like to check the original indication. I think it's the best way to learn formulas. Never trust anyone else who tells you the indication of a formula. Always go for the original indication first, and then you have your own ideas, and you can consider all the stuff as well. So for Xiao San, it's indicated for blood deficiency related with exhaustion. Again, they clearly tell you this is not acute infectious disease. This is a chronic condition that's is due to overwork and etc. Consumption of resources. So manifested by agitation and heat of the 5 hearts. Seems a little bit more like a yin deficiency and fire type of problem. Limbs pain, although I would say Xiao might be better for that. Dizziness, palpitations. So we have the relationship with the heart. This is more obvious here. Redness of the cheeks. Again, this can be a yin deficiency and fire type of context. So lack of blood, lack of essence. Dry mouth and throat, fever, night sweats, reduced appetite, so the relationship between the liver and the spleen, of course, hypersomnia, as well as enmeshed blood and heat, irregular menstruation, so this one is an important one. It's extremely common to use Xiao San for menstrual disorders, abdominal distension and pain, so again, this is more internal problem. For Xiao it will be more muscle and tendon pain rather than abdominal pain. Chills and fever like malaria. Although again, I would say Xiao may be better for that. It's very common to use Xiao Yao San for all the menopause-related problems, because again, there's this idea of blood essence being consumed, the liver is not functional, and there is excess or constraints going on. Gynecological conditions, extremely common again to use Xiao Yao San for, how is called again, perimenstrual disorder, when people get distressed around the period, for period pain, for when the cycle is not regular, etc. All kind of diseases, really. We use it for neurological conditions, especially impotence as well, but more related with emotions, of course. So we'll think about Xiao Yao San instead of Xiao Tang, because again, this idea of genitals, drain channel is going to the genitals. In general, I think it's a great formula for stress, for chronic stress, because again, the reason why we have this stress, why we're easily stressed, is because there's a lack of blood and the spleen is too weak to have this counterbalance of the liver, right? So Xiao Yao San is really here to help us now for chronic stress, for reinforcing the blood, so we don't react that easily to external stimulation, and also our spleen is very strong, so we can also take in more stress without being stressed, right? We can take more stress triggers and not feel stress. So I think Xiao Yao San is really doing that on the long term. Xiao Tong can be a good fix for a short-term symptoms related with stress, but it won't really fix the root of the stress, which is lack of blood and a weak spleen. Then we have the stress-related digestive condition. Again, this idea of stress-related heart conditions, the relationship with the pericardium, don't forget that. And we have all these chronic headaches, chronic anxiety, and insomnia. Again, we are working to make the liver more healthy because it has a really good context to be healthy. And finally, breast conditions, especially hyperplasia. Again, this is a chronic condition. The liver constraints is coming back again and again. Why? Because the blood is deficient and the spleen is too weak. So instead of trying to move qi strongly, what we do is we reinforce the organs to build a good context for the liver to work well. Of course, hyperplasia is related with stress and with menstrual problem as well, so it's not very surprising, right? All right, so this was a comparison between the Xiao Hutang and Xiao Yao San from the perspective of the two channels, Shaoyang channel and Jueyin channel. I hope this was helpful, and I wish you a great day.